breast cancer that's already spread to other parts of the body. Now, is it curable?
You have bleeding tumors, which you cannot control with chemotherapy alone.
It is important to know that they are generally covered by most insurance companies, the good ones.
Here comes the final episode of the Hormone Positive Health Chat series. We learn how to approach stage 4 breast cancer. Check out the previous Health Chat episodes on Talk Health Asia's YouTube channel and don't forget to subscribe.
I mean, if we just touch base, Dr. Kiley, in terms of breast cancer that's already spread to other parts of the body, now, is it curable?
Okay, so it is usually, unfortunately, incurable, okay, because the cancer cells have spread to organs or body parts that are away from the breast and the local lymph nodes. Now, when this happens, it is usually no longer possible to remove the cancer cells from the body, even if we give people chemotherapy, targeted therapies, radiotherapies in general. However, we know that in a small number of patients, they sometimes have what we call limited stage 4 breast cancer. That means the breast cancer has spread, but it's ready to just one or a couple or two parts of the body, or they're fairly close together. Then usually in these cases, we need to discuss in a multidisciplinary meeting, with various specialists and decide what is the best way to treat this patient. And sometimes if the patient fits the bill, we may actually attempt a curative approach for this patient. But generally, by and large, once the cancer is spread beyond the breast and the local lymph nodes, is very hard, and it's generally considered not curable.
Is it treatable? And what are the treatments?
Definitely, it is treatable. Okay. Before we treat, for every patient that comes our way, it is really important to know the goals, to know what are we aiming for before we start any treatment. So the goal of treatment in stage 4 hormone positive breast cancer is really to control the cancer, to relieve any suffering that the woman may have, and importantly, to also prolong her life. Okay. Now, so that's the goal that everyone needs to be clear of. That I think sometimes us doctors, including myself, we speak too fast, and we are busy. We don't spend enough time talking about. So patients need to be aware of this, so we're all on the same page, as we go along this journey. Now, in most patients, the right treatment, okay, is a combination of an anti-hormone treatment, okay, and a targeted therapy called a CDK4/6 inhibitor. Okay, very long word, and someone asked that question in the chat box. What is a CDK4/6 inhibitor? Essentially, it is a targeted treatment that targets a group of proteins called CDK, or or cyclin dependent kinase number 4 and 6. Okay, proteins that are actually involved in helping the cancer cell to divide. 1 become 2, 2 become 4, and so forth. So when we target that machinery, we stop the cancer cell from growing and we kill the cancer cell. Now, in postmenopausal women, okay, we usually use an anti-hormone, which is an aromatase inhibitor. And in premenopausal women, we usually give menopausal treatments. I mentioned earlier anti-hormone injections or surgery to remove the ovaries. And this is done in combination with an aromatase inhibitor. In terms of the targeted treatment, okay, as said before, the CDK4/6 inhibitors are really, really important when we use it with the anti-hormone treatments. I can still remember back in 2015, when the first results came out, and the first of the 4 CDK4/6 inhibitors was approved. So this was really a watershed moment, in hormone-positive breast cancer. And since then, the combination of these anti-hormone treatments, usually tablets, with CDK4/6 inhibitors, also tablet, have consistently controlled stage 4 hormone-positive breast cancer, for an average of just over 2 years. Now, this is, for us, is actually really quite good, because women can actually have their cancer controlled just by taking some tablets, without the use of chemotherapy. Now, in fact, some women do go on to have their cancer controlled for many years. So in fact, I have some patients that have exceeded 5 years. And one lady that is under my care, she's entering her 7th year of treatment. So, and in recent times, it's very important for you all to know that the research have also shown that these CDK4/6 inhibitors have outperformed chemotherapy, our usual go-to treatment, for breast cancer. And not only does it control the cancer longer, it also has much less side effects. So as such, right, most patients should really have an anti-hormone treatment and a CDK4/6 inhibitor.
Thank you, Dr. Kiley. So I echo the fact that despite we talk about stage 4 breast cancer being incurable, it is really important for us to get the message across for patients and women out there to come and have the treatment, because this treatment works and can prolong your life expectancy. But how affordable are these treatments, Dr. Kiley?
In terms of costs, right? So they cost roughly about 5,000 to 6,000 ringgit a month, but can be less than that depending on the doses that we use, because we know every woman is different, and we need and the dosing is also different. So some women can only tolerate a lower dose, and for certain types of CDK4/6 inhibitors, that will also translate to lower costs as well. It is important to know that they are generally covered by most insurance companies, the good ones. However, we mustn't forget that access to these medications can still be quite limited, especially in the public health setting, due to the costs involved.
I work in the university under Ministry of Education, and under Ministry of Health, this drug is covered under the Blue Book, but again, it's based on the quota that's available. If we look at the evidence, Dr. Kiley, surrounding your decision-making in terms of what treatment is best for the patient in front of you, can you just sort of explain to us how you make sense of the evidence surrounding oncology treatment?
Sometimes, patients wonder, yes, you tell me that these medications work, but usually clinical trials where these new medicines are being tested in, they usually involve patients that they're quite fit, and sometimes they may not represent the general patient that we see in clinic, But then there have been what we call real-world studies, looking at the effectiveness and of at least one particular CDK4/6 inhibitor that showed that it is actually similarly effective even in real-world studies. That means that the patients that you and I see in the clinic compared to the clinical trials or the controlled studies. Yeah. So real world studies are important for us to know if the treatment actually works outside the clinical trial. Okay. Now, they're usually done based on data that is collected, from large numbers of patients from participating clinics and hospitals, and they're assessed over a period of time. Now, if let's say we see real-world studies that don't match the clinical data, then we will be quite worried, whether these results actually apply to the patients that we see in clinic or not. But fortunately, in the case of CDK4/6 inhibitors, it does. So it does work.
So if we just turn our attention to Dr. Saladina in terms of metastatic breast cancer, when you hear that it's an incurable disease, one immediately thinks, oh, surgery is not an option of treatment. What would you say to that, Dr. Saladina?
Surgery can still be offered even in stage 4 breast cancer. And the reason for that, you never say never in cancer treatment. In generally, patients with stage 4 breast cancer, the intention to treat and the intention to do surgery is different from the early breast cancer the group. So for patient who has stage 4 breast cancer, when we diagnose, even at when they present to us first, when we assess them and we found that when we did staging, it's already distant metastasis to the bone, for example, we will refer to our oncology colleague for them to have systemic therapy first. And once that once they go on systemic therapy and we assess the patient's respond to systemic therapy, and in subset of patient where the response is so good and they are relatively well, even with stage 4 disease, we do offer surgery. And that is done because we want to reduce the tumor burden. We want to improve the local control of the disease. Apart from that, we do operate on stage 4 patient, in patient whereby the cancer is bleeding. They have bleeding tumors, which you cannot control with chemotherapy alone. And in this subset of patients, surgery is performed. We call it toilet mastectomy because we need to control the bleeding issue, because we don't want our patient to go into chronic blood loss issue, which requires regular transfusion, and that would render them to be less fit to receive the systemic therapy. Yeah. So I generally would offer stage 4 breast cancer patients surgery option following an MDT discussion with my oncology colleague with the intention for local control. For example, like earlier, Kiley mentioned about heterogeneity in a breast cancer. You can have breast cancer which are originally hormone receptor positive, HER2 negative, on treatment with CDK4/6 inhibitor with an aromatase inhibitor over a couple of years, and you find that they were doing very well. The tumor seems to be responding with this treatment, and suddenly, as you've monitored them, they develop new lumps in the same breast. So that subset of patients, sometimes when you are seeing someone who has, let's say, a responding tumor to the treatment that we offered, and suddenly now they develop new lumps, and you have to reconsider, has the cancer changed in terms of characteristic? So we will either biopsy the cancer and see whether it's the same subtype or they have actually changed. And in this group of women, if let's say they have distant metastasis and it renders them less fit for systemic chemotherapy, doing surgery may be one of the better local control while continuing the current hormonal therapy. Yeah. For example, I have a patient previously that was presented with stage 4 breast cancer, hormone receptor subtype positive, HER2 negative. She presented with severe back pain. And during workup, we found that it's actually metastatic to the bone, and it was treated with radiotherapy to control the pain, and she was started on hormonal therapy as well as CDK4/6 inhibitor, and she was doing very well for 3.5 years. And from someone who cannot walk on wheelchair, she was able to walk unaided. She was able to get her original previous life back on CDK4/6 inhibitor and AI. But over 3.5 years of treatment, she developed a new lump in the same breast. And that is different. That is ER. And that new tumor is actually triple negative subtype. The original tumor that she had in the breast is completely gone, but developed new tumors. So this subset of women, when we discuss with the patient whether they want to actually switch to chemotherapy, some women, they rather go for surgery and maintain the original treatment. Of course, there's a lot of discussion back and forth with the oncologist and the surgeon, but I do not actually deny patient the option of having a better local control with surgery, even though they're stage 4. So bear in mind, stage 4 patient, there are many types of stage 4. Those who are fit, healthy, will certainly benefit from surgery. And there are studies to show that this group of women, when we do surgery for them, they actually have better disease-free survival period.
Thank you, Dr. Saladina. I think that is really the take-home message. It depends on the patient factor, as well as the discussion between patient, oncologist, as well as the breast surgeon. With that, I would like to bring our session, sort of this discussion session, to a close. I would like to introduce to you talkhealthasia.com, which is a website full of medical information, where you can get YouTube videos to understand health issues. So not just cancer related. It's targeted for patient as well as caregivers, and they're really in a format which is easy to understand for our local population.
Subscribe to Talk Health Asia's YouTube channel for more health chats episodes, or find easy to understand health videos on talkhealthasia.com.